Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is newer innovations in effective teaching for nursing students. And we are privileged to have Professor Lisa Leo, who is our Principal College of Nursing from Saroornagar, Yashoda unit. I welcome you, Lisa.
Good evening, Shanti, and thank you for having me on this webinar. It's indeed a very interesting topic today.
Yes. And I would also like to welcome our speaker, who is Ms. Leelavathy, Professor HOD of OBG Department from the same unit. I welcome you, Leela.
Good evening, ma'am. Thank you for giving this wonderful opportunity. I am Mrs. R. Leelavathy, Professor from Yashoda College of Nursing, Saroornagar branch.
Yes. So first insight, we would like to ask, Lisa, that why are newer innovative learning important for nursing students? Your insight for the same.
So, innovations, according to me, are very, very crucial for nursing students. It is a tool and knowledge to meet the demands of nursing practice today. For example, if you take situations where the student has to work, she needs to know the newer trends. That's what is my opinion.
Okay, and so rest of the discussion we will, have over to you, Leela, for the rest of the discussions. You can take over. Yeah.
Yes, ma'am. So in this slide, if we see the patient with the side rails, so first we should assess the situation and understand what is the need of using side rails for the patient and analyze and act accordingly with confident so that we can able to improve the patient outcome without any delay.
Yes.
And let us discuss clinical reasoning and timely application of knowledge and skills are key to safe patient outcome. Yes, clinical reasoning and timely application, it is very important for both nursing students as well as the bedside nurses who are working in the hospital to make accurate diagnosis and prompt intervention.
So here I would like to have your expert opinion, Lisa, that is clinical reasoning a key demand in healthcare industry today?
Yes, indeed. Clinical reasoning is very essential for better patient outcome because here we need to analyze the information. Second thing, make decisions about the patient care because quality matters a lot.
Yes. Yeah. Yes, you can take over. Yeah, Leela.
Let us discuss adapt and learn from precision-based modern technology, robotic surgical system in OT. Is artificial intelligence helpful?
Yes, so Lisa, I would like to have your opinion on the same. Is artificial
Yes.
learning helpful? Yes.
That's my most interesting topic, actually. So, yes, at the moment we have personalized AI tutors available to assist the students. And then there's a lot of communication assistance also to assist the students. And there are question banks, there are practice questions, there are personalized strategies, study strategies, learning strategies for the students. And student becomes more confident when also they get the feedback of their answers.
I think decision making becomes very easier and they are guided. Yes. And Leela, to you, I mean, you must be seeing all your students, sometimes do they use this AI related chat, GPT, chat boards and all? Have you
Yes, ma'am.
witnessed?
Yes, ma'am.
Yeah.
AI is really helpful for our nursing students in order to identify their strength and weakness to improve their learning as well as communication. They can translate and it may break the language barriers, and also it is very useful for exam preparations.
Yes. Yeah, I think this is also very important. It helps in role play conversation with the patient as well.
Yes, ma'am.
Yes.
AI helps practice nurse-patient conversation scenario like example. I'm really nervous about my surgery tomorrow. This is a conversation by patient. A nurse
Yes.
replied like, I understand and how you are feeling. It's completely normal to be anxious. You are not alone and we are here to support you. So these are meeting the real life scenarios for the students to learn how to take care of the patients in future. Like in case of preoperative management, we can reduce the fear and anxiety and we can promote emotional support to the patient.
Yes, not only preoperative, not only about the surgery, maybe a medication administration, maybe a patient has been transmitted to other department. All these bedside crucial procedures, I think nurses can always take the help and they can deliver to the patient, yes. And yes, here we would like to acknowledge the effort and guidance from our director, Dr. Pavan sir. He's as it's quoted, we have quoted trying saying learning begins with mentor. And I think yes, essential support and directions have been given by Pavan sir continuously. I like to acknowledge our director's effort. And yes, and we have very nice facility like located at Saroornagar. And here we cannot ignore the support and guidance from our dean sir, all the principals from different colleges, and all our faculty's effort. Yes. Going forward, let us discuss about the ninth slide. I think, yes, Leela. Yeah, ninth you can take, and ninth slide. Yeah. So, Lisa, here I would like to ask you, I think this is a very tough question, so which I'm, asking you. Do we see a good amount of attention span when our students are inbound, classroom inbound? Yes.
Well, I can understand very well nowadays that the attention span is pretty less.
Yes.
Especially, there's a pointer there talking about the Gen Z generation, and it says that the attention span is only 8 seconds, but truly that is not the right data. Why is the attention span very less in Gen Z is something we need to understand. The thing is because they filter the information and prioritize their learning strategies, because we bombard them with lot of information nowadays with books
Information.
and
Yes.
e-resources and everything, but they are pretty smart in handling situations and they're pretty quick. That is my opinion.
Yes, yes. Yeah, they are smart, and I think, yes, if you see the classroom bound, and sometimes I think, Leela, if you see, I mean, you're the mentor,
Yes,
whenever
ma'am.
you give a lecture or lesson planning to your
Yes,
students,
ma'am.
and what do you see to engage your students in the classroom? Do you
Ma'am,
see there sometimes, yeah, the attention span little bit goes down? I mean,
yes,
that time,
ma'am.
what do you do? Yes.
Yes, ma'am. While taking classes for the nursing students, really, I personally experienced that their attention span is very less. So we are just implementing all the innovative methods like making the session more interest by including all the interactive experiences like storytelling. So all the innovative methods we are implementing to grasp their attention towards the
Yes.
learning process, ma'am.
I think yes, this generation needs a lot of fun and connector-based activities. And
Absolutely.
yes, and Leela, do you say sometime, yes, if you don't listen, I'll call principal, ma'am. Do you say this statement as well?
Yes, ma'am.
Yes, yeah.
Yes. Nowadays,
Going, yeah.
students they need the bite-sized information, ma'am. The most
Yes.
easiest content they need to adopt.
Very prompt and easily customized, available. Yes. Yeah. Take over again. Yeah.
Yes. What are the most effective, innovative teaching currently transforming learning for nursing students in our colleges? Yes,
Yes.
ma'am. We are implementing all the innovative teaching methods like simulation-based learning, hands-on skills. It is really making the students to get involved into the real life situations or scenarios, and e-learning or digital learning like webinar, it is online presentation, so any way the students can able to listen and understand and watch, and quiz, it is nothing but assessment knowledge tool for the students to engage and improve their communication skills and knowledge. And role play, it is a fantastic learning technique for the students. And interactive case study and case presentation is nothing but informal in-depth presentation by the students about the entire scenario of the patient condition. And NCLEX preparation, already we are following NCLEX preparation. It is very
Yes.
crucial for the students to get the license, so they should pass in the NCLEX. And the other one is informal learning, like watching YouTube, health reels, etc.
So the question to you, Leela, again, which learning they like, which method of learning
Ma'am,
they like to opt out the most?
yes, ma'am. Nowadays students are very much interested on video-based learning. So
Yes.
whatever, rather than referring the textbooks, they are easily getting all the knowledge from watching YouTubes and health reels, and they are creating their own awareness rather than
Yes. Yes.
going and sitting in the library for a long period of time.
Yes. I think, Lisa, you will also agree with the opinion which is right now set by Leela.
I
Yes.
totally agree with that.
Yes. Because we see students, they are very good at making like a TikTok and the reels kind, which sometimes I'm surprised to see so good editing and correlation with the content they do. Whenever I see somebody's status and all, yes, as you all said, yeah. So, Lisa, as Leela was mentioning the benefits of role play, and I'm sure you all are practicing this sometimes, and the viewers are all your students. You all validate their, efforts. So, does it gives a benefit in towards the bedside nursing? Yes, your opinion on the
Absolutely.
same.
It benefits the students in many ways. Like we have seen students transform themselves in, as the years go by. For example, it improves communication, it builds a lot of confidence because the students usually get prepared prior. And it
Yeah.
happens that they don't hesitate even to come forward and stand and do the case scenarios or any kind of role plays.
And they can be connected to with the empathy as well. I mean, yes, yeah.
Yes. So let us discuss, prepare the students to handle real-time patient care challenges guided by empathy in action, especially in high-pressure clinical situation.
Yes. So my again question to Lisa, to you is, go back to the 13th slide, is whether this traditional method also is important. It is mandatory because curriculums are very tough. But this modern learning also helps student nurses when they go to the bedside, when they present, when the video presentations are being asked and the case presentations, they are supposed to present all this. So what is your opinion on this?
Yeah, see, I actually always appreciate the traditional method of teaching, but then the generations are different. The requirements and the demands are different in the healthcare industry. So it happens that we have to have a balanced perspective with the students. So in that case, a hybrid model or a mixed model is always better for the students. And it bridges the gap of learning also. And it also strengthens the student-teacher bond, basically.
Yes, as you have very well validated this point. Yes, yeah, Leela,
Ma'am, yes,
take over.
ma'am. Of course, I can agree this point because traditional method involves personal interaction, like face-to-face interaction, and it is the basic skill for the students to learn. And on one more thing, not only traditional method, we we will try to implement the hybrid model methods also. Why means when they are going at a clinical situations, the bedside presentations and all, they can able to apply the theory knowledge into practical base. So what my point is, a blended learning, like they should use both the traditional as well as the hybrid models in order to learn in an effective way.
Yes,
Yes.
and this concept, whenever sometimes when I go for rounds or I get to see these students, they are very able to present the cases. Like I see, even I think this perspective of presentation has been started with Dr. Pavan. Anytime he goes in, anytime we see nursing heads or their subordinates, say you guys, whenever you go in, like you ask, no, what is a case? And then I used to hear even Dr. Pavan asking them, what is the outcome? Are the family members happy? Have they been informed about the outcome of the patient? I think this series of learning is really going to benefit our nursing students in long time. Yes, yeah.
Yes.
So Lisa, again, this is for you. Yeah, I'm sure this is done. Students like learning when they are, and yes, your opinion or your expert insight on the same. Yes.
Yes, with our experience, we understand that we need to speak to the students, we need to address the students. And at the same time, we need to listen to the students. That is very, very important in communication. And we need to engage the students in a very, very innovative way. We don't follow the regular lecture and demonstration method. Like we've been talking in the previous slides about role plays, webinars, quiz, etc. So all these are basic things that we incorporate in regular teaching also during the sessions. And we keep the sessions pretty small. And we also help the student to speak out or present. And we also acknowledge them and praise them whenever the opportunity comes.
Yes, and this mechanism works. Yes,
Absolutely.
yes, and so we have come here. I think we have reached to the end of the discussion, and the final conclusion of note for your participants or viewers and the nurses who are watching this webinar across. Lisa, to you from your end. Yes.
Yeah, see, we need to understand the modalities of learning which has transformed so much to this era, I would say. Like, we have to be very student centered. It is not just the bookish learning. We need to understand what the student requires actually. And the most important aspect is, the communication skills that we really have to enhance to build up that confidence to address a patient, to handle a patient, and handle any situation as such. So, as teachers, we need to be very, very flexible in giving them the opportunity to learn, because that only can transform a student.
Yes, very valid point for all the viewers. Yeah. And I thank both of you for your valuable session. I think, yes. And I request all the participants to log in with our www.yashoda.website.com. We have three colleges. You can just log in, select nursing, and gain all the information. We have got very beautiful curriculum. You will, all the messages and informations can be just read by you all. And we end the session. Thank you, Lisa. Thank you, Leela, for your valuable
Thank
time.
you, ma'am.
Thank you. Thank you so much.
Thank you.